Hello everyone, welcome back to our channel, The Upcoming Doctors. So after a long time, we are discussing into the second year topics. Our first subject is the microbiology. I'm going to discuss the fungi, that's mycology. From that, the topic is cryptococcal meningitis. So this is an important question for your university exams also. So let us get into the topic, the cryptococcal meningitis. So we will address this topic in few headings, which I prepared was the introduction, species and serotypes, and also the pathogenesis, the clinical manifestations, habitat, and the laboratory diagnosis of the Cryptococcus neoformans. So this and all, the above 5 topics will be discussed in the part 1 of this video, and I'll make another video to get the complete understanding of the laboratory diagnosis regarding the Cryptococcal neoformans. So coming to the introduction part, the Cryptococcus neoformans is the microorganism which is the capsulated yeast, and it is a primarily CNS, central nervous system pathogen, and it is capable of producing the potentially fatal meningitis. So this fatal, it will causes some inflammation of the meninges of the brain, and it will lead to death also if untreated. Okay, so who are the people who get this cryptococcal meningitis? Means the immunosuppressive patients will get this. Like example is the HIV infected people. So this is the brief introduction. We'll getting into the species and the serotypes. We will see first of all the serotypes. We have just 4 serotypes, A, B, C, D. Okay. Coming to the species, we have 2 species, Cryptococcal neoformans and Cryptococcus gettii. So we can correlate these 2 species with the 4 serotypes. The Cryptococcus neoformans will be correlating with the A and D serotypes, and Cryptococcus gettii will be corresponding to the B and C serotypes. You just mention in your answer sheet regarding this species and serotypes. That's all. And coming to the pathogenesis, which is an important one. The infection is mainly, the mode of transmission is the respiratory tract through the aerosols. When we breathe these aerosols which are contaminated with cryptococcal neoformans, then we will get the infection. The infectious forms are 2 forms, which are yeast cells and the basidiospores. The basidiospores are the sexual stage of the cryptococcus. We already discussed it is an capsulated yeast. Okay. So what happens in the two individuals, which are immunocompetent individuals and immunosuppressive individuals? In immunocompetent individuals, our lungs performs the defense mechanism and limit the infection only to the lungs, and it will not spread the infection anymore. Whereas in the low immunity patients, which means who are having the immunosuppressive conditions, like in HIV patients or transplant recipients, I'll discuss there in the risk factors. So in that patients who are having low immunity, it will first enters into the blood. This infection will enter into the blood and it will spread all through the blood, and then it will causes the infection of the lungs, which lead to the pulmonary infection. So this is all about the pathogenesis. Okay, so we are going to discuss about the other condition, that's a CNS spread, virulence factors and the risk factors of the cryptococcal neoformans. Okay, so what happens in the central nervous system? This cryptococcal neoformans microorganism have a unique feature of crossing the blood-brain barrier. So it will cross this blood-brain barrier in 2 ways. One is direct one, another one is the indirect one. In which form it will cross? It will cross in the form of yeast cells. Okay, it is a capsulated yeast. No, it will cross in the form of yeast. So this is the this is the blood vessel, and this is the endothelium, which is the innermost lining of the blood vessel. So the cryptococcal neoformans, which will cross outside the blood vessel into the brain through this endothelium. It will directly pass, and indirectly it will cross the blood-brain barrier with the help of macrophages. So whatever I drawn here is a rough diagram. The outside one is a macrophage, and inside this dot is present. No, that is our Cryptococcus neoformans. So Cryptococcus neoformans is covered by this macrophage, and it will enter into the brain. So you see one word here, no? This is a Trojan horse. What does it mean? It is a simple English metaphor, which means the enemy is secretly entering inside. Means here, who is the enemy? Our Cryptococcus neoformans microorganism is the enemy, because it is causing the cryptococcal meningitis. Na? That's why. After that, this macrophages is our it is a protection for this cryptococcal neoformans. With under cover of this macrophages, it is entering into the brain. Who? The cryptococcal neoformans. So that's why here comes the English metaphor. That is a meaning behind the Trojan horse. Okay, this is all about the CNS spread, and we are going to discuss another topic very important, that's the virulence factors. So we have four virulence factors, mainly the polysaccharide capsule and the melanin, and also the enzyme phenyl oxidase, and two more, that's the phospholipases and the urease. You just remember the polysaccharide capsule is antiphagocytic and also inhibits the host local immune response. Okay, these 2 points you have to remember under the polysaccharide capsule. This is the capsulated yeast, and it will have importance in the laboratory diagnosis, which I will discuss further. And also the Cryptococcus neoformans will produce an enzyme, namely the phenyl oxidase, and it will make the melanin. It will produce the melanin with this enzyme. You are fresh from biochemistry. I think you have an idea regarding the tryptophan metabolism and how the tryptophan, after the few steps and then polymerization, it is converting into the phenyl oxidase. With the help of this enzyme, the tryptophan can be converted into the melanin. Okay. And also of the Cryptococcus neoformans will produce two more enzymes. One is the phospholipases, another thing is the ureases. You just remember these enzymes. I will discuss what is the importance of these enzymes in part 2, that's a laboratory diagnosis, right? And coming to the risk factors, who are at risk of developing this cryptococcal meningitis means, first one is the HIV patient. So HIV patients having the immunosuppressive condition, that's why in advanced HIV, nothing but the CD4 count is less than 200 per microliter. They are at risk of developing this cryptococcus meningitis. Okay, we already discussed that two species are present, Cryptococcus neoformans and Cryptococcus gatti. The Cryptococcus neoformans will cause the infection in the immunosuppressive and immunocompromised individuals, whereas the Cryptococcus gatti will be causing the infection in the immunocompetent individuals. So another risk factors are the hematological malignancies, cancers, and also leukemia, like that, after the transplant recipients. And another last point, which is an important one, is the immunosuppressive or the steroid therapy. Now comes the point. I'll explain this point in some detail. If you want, you can write in the answer sheet also. So what are the steroids are used for? The corticosteroids are very important in therapeutic dosage, like in the acute adrenal insufficiency, chronic adrenal insufficiency, this can be used. Okay, in pharmacology we'll discuss that. In acute adrenal insufficiency, the corticosteroids are medical emergency. We have to treat it with the corticosteroids. After that, in other inflammatory, steroids are nothing but the most important property of steroids. What it is an anti-inflammatory action, so it will reduces the inflammation. That's why it can be used in the inflammatory conditions like the rheumatoid arthritis, rheumatic fever. After that, gout. You have a mere idea about gout, no? This inflammatory condition of the joints due to the accumulation of the uric acid crystals, right? So in these conditions, and also in the bronchial asthma, all these conditions we can use the steroids. But this steroids has an adverse effect. What is it? It is an immunosuppression, because it acts on the immunity and causes the suppression of HPA axis. You know, this HPA axis is present. H refers to the hypothalamus, P refers to the pituitary, and adrenal axis. So it will cause the this suppression of the HPA axis. It will ultimately lead decreased immunity. That's why for the patients on steroid therapy, they are at risk of developing this opportunistic infection. One of them is the cryptococcal meningitis. They should be very careful, right? So this is all about the risk factors. You can remember this. And coming to the clinical manifestations, again this signs and symptoms which are present, very important. We will see all the symptoms which are present. Most common we already discussed in the pathogenesis. Which organ is affected first and which it will respond means lungs, right? So pulmonary infection is the first and the most common manifestation of the clinical manifestation of the cryptococcal meningitis. And meningitis means involving the head, so it will cause the headache, fever, sensory loss, and also memory loss. And the last one is the loss of vision. Because of optic nerve involvement, we'll see the loss of vision here. And we have two more things, the skin lesions and the osteolytic bone lesions. You just remember each and every point of the clinical manifestation very easily, because outermost layer is the skin, no, and innermost is the bone. So you remember like that, skin and bone are affected, and the other thing is the lungs are affected. And common features which are related to the meningitis is nothing but headache, this and all, right? I think it is quite helpful to remember all these clinical manifestations. We'll discuss the habitat, that is the last one we need to discuss in this topic. The habitat, because why we need to give that importance to habitat means, we'll get the case scenario regarding this cryptococcal meningitis. Like the case will be like this: a patient presented to you with all the clinical symptoms which I said, no, like headache, memory loss, sensory loss, or loss of vision due to the optic nerve involvement, and also the skin lesions may be present, in osteolytic bone lesions that will be present. So in this form, and again the history will be like this: the patient is in contact with the soil which is contaminated with avian excreta or the pigeon droppings. So you should remember that is because of the cryptococcal neoformans, and the disease is the cryptococcal meningitis. Coming to the other species, which is not the much importance, so the cryptococcus getty, and it will be having the habitat in the eucalyptus tree. So please remember this clinical features, and this avian excreta pigeon droppings which is contaminated in the soil, that is the organism, microorganism is the cryptococcal neoformans, and the disease is the cryptococcal meningitis. Through this you can solve the case scenario also. Yeah, this is all about our video. That's the first part of cryptococcal meningitis. I'll be back with part 2, which will be in detail about the laboratory diagnosis. You can like, share, comment on this video, and you can comment me whatever the topics you want, so that I can do make sure to make the videos. Yeah, thank you so much for your support. Thank you. Jai Hind.